Cases of poor health facilities and increased quacks in the profession has been on the rampant, with the latest case of negligence reported in Shalom Hospital and questionable quality of health services at the Kirinyagas Kerugoya Referral Hospital. Subsequently, the Pharmacy and Poisons Board has been on a crackdown mission across the country. The board pitched tent in Kilifi and Mombasa counties for the last 3 days, with casualties on its way. At least close to 23 health facilities and chemists have been closed.
Kilifi, they inspected 127 facilities, and 10 of them were closed. Yesterday, on my way from Kilifi, I also passed through Mutwapa. I inspected the chemists there, and I closed 11 chemists because either they did not have the qualified personnel or they did not have the license that is needed for them to practice. So this is an exercise that is going to go on throughout the country.
The latest hospital to be closed down is the Seaside Hospital in Ganjoni, Mombasa County.
We inspected this facility, but we observed that it did not comply with the standards. But we also observed that the waste management and disposal systems actually are still below the standards. And therefore, with those non-compliance issues, we actually gave out a closure notice to this hospital. According to the Pharmacy and Poisons Board Chairman, Dr. Jackson Kioko, even after issuing a notice to close down the facility on Tuesday, the board was surprised that the rogue operators were displaying different notices announcing that they were closed for renovations. It was reported to us that there was another notice that was put outside the facility indicating that the facility has been closed for renovation. The facility was not closed for renovation, but the facility was closed due to non-compliance. And that is an illegality on its own.
He assured the public that the facilities will remain closed as per the directive.
It is not a one-time off exercise as it has been, but this time round the government and the Ministry of Health, through the various regulatory bodies, is going to ensure that Kenyans are able to access services.
Dr. Kioko noted that the inspection, which will last for the next 90 days, will not spare any defective health services provider.
This exercise is intended to last 90 days to ensure that we inspect all hospitals, all nursing homes, and all the clinics, all the chemists that are and the laboratories that are providing services to Mwananchi, and to ensure that they meet the standards that have been set to provide services for Kenyans.
It is business unusual for health centers, hospitals, and pharmacies across the country, as the Ministry of Health is on a mission to crack the whip to ensure that Kenyans get the services they need. From Mombasa County, I am Anburu.